Hello, my name is Dr. Tariq Hakky, and I'm a urologist, and we're going to discuss erectile dysfunction and the different treatment options that are available for you today. As you can see here, I practice out of Atlanta. My business is that I practice out of is called Atlanta Cosmetic Urology. I'm board certified, and I focus on penile prosthesis, and I'm a high volume center. There's a disclaimer here. You can read through it. Um, The goals of this presentation is to educate men and their partners about erectile dysfunction and the treatment options and the implications of not treating it and what the warning signs are. So we're going to start off by going through the erectile dysfunction facts. Then we're going to go to the treatment options. We're going to have a patient perspective, and then we'll go through some other additional resources. So erectile dysfunction is defined as the inability to get or maintain an erection. And it impacts you in many ways as men. So ED impacts your intimate moments, right? But it also affects your life and your overall confidence. And the first step, in treatment is recognizing this is a problem and finding the solution to get your control back of your intimate life. The Massachusetts Male Aging Study looked at ED and the rates, and they found that up to 1 million men in the United States had erectile dysfunction. And 40% of the men over 40 years old had some form of erectile dysfunction. And in all cases, erectile dysfunction is definitely treatable. So you're not alone. It's very common. And what's interesting is erections is kind of a place where erections is medical, meets a psychological, meets a religious intersect in the body. So erectile dysfunction has definitely some psychological impacts, right? And 50% of the patients that have erectile dysfunction say that it negatively impacts their life. Many other patients will come in and tell me, it's also affecting their marriages as well. And many men complain that the erectile dysfunction causes them to have lower confidence. This one study reported here says 84%, and the negative impact on those emotions that these guys carry is one where they're disappointed, they're angry, they're frustrated, they're ashamed, they have insecurity issues, and these psychological issues carry forward into their lives, into their marriages with their partners, into their business relationships, into their lives. So this will percolate down through the rest of their of this guy's life, right? So not treating the ED, not treating the psychological effects of the ED has negative impacts, right? And 50% of men with erectile dysfunction, report that it has a negative impact on their relationships in their intimate life. Erectile dysfunction, right? We already defined what it is. It's the inability to get or maintain erection. And it can be a myriad of from, not being able to get one completely, or not keeping the erection, or not getting consistent erections regularly. So what causes erectile dysfunction, right? So there are many different causes for erectile dysfunction, right? There's 4 reasons for you to visit a doctor. And where am I going with this? 3 of them are risks for ED, right? So hyperlipidemia, right? High blood pressure and high cholesterol. The fourth reason you'd visit a doctor is for a wellness check, right? So, in the world of erectile dysfunction, you're going to get ED or be at risk for ED as you age because you're going to get those other factors. But you can categorize ED into risks from diseases such as diabetes, high blood pressure, right? Hyperlipidemia, high cholesterol, right? You can also look at it in medications. The antidepressants, the SSRIs, are notorious for causing sexual dysfunction, right? You've got other medications, that do cause erectile dysfunction, that come with some of the calcium channel blockers, metoprolol, the beta blockers, right? Certain drugs, alcohol. Alcohol is a downer. It'll actually make your erections worse, right? Removing the prostate can injure the nerves and the blood vessels to the penis, causing erectile dysfunction. And then there are patients that have injuries to the spinal cord, having some sort of erectile dysfunction from nerve impingements. But most of the time, erectile dysfunction is a non-psychological issue. And what's interesting is, Prior to the 1990s, if you came into somebody doctor's office and you said you had ED, they would send you to a psychologist because they're like, oh, it's in your head, right? So now we realize that 80% of the time it's not in their head, and so we'll talk about some of the tests that we'll need to do to kind of work that up, right? So how does an erection occur, right? So there's two types of erections. There's the reflexogenic erection, and there's the top-down erection from the brain. So sexual stimulation is part and parcel of the brain working with the blood vessels, working with the nerves to induce blood flow into the erectile body. So blood becomes trapped in the erectile bodies. So there's a stimulus either from feedback from stimulation to the penis, or the brain will stimulate down the spinal column. And what will happen is the blood vessels to the penis, the corpora cavernosa, will have dilation from nitric oxide, and the smooth muscle inside the penis will fill with blood. This results in an erection. This slide is really, really, really important, and that's why I think that we would take some moment to pause on this. No matter what your cause of ED, psychological, medical, surgical, there is treatment options for you, right? I tell my patients, when I see them, I was like, I can get you an erection. It's just how you want to go about doing it, right? And so that's kind of the caveat, and as men, we have this bravado, macho, hey, I'm so good, I don't need to get treatment and things like that. And, we brush things off, and it's really not right. And I think that, it's why men tend to live shorter lives. We tend to be sicker because we tend to push things off, and this is something that, you and your partner both suffer when you don't get this fixed. And there are many easy fixes that are available. It's just embarrassing. So we're going to go through the treatment options. So the superficial overview is going to be pills, needles, vacuums, muse, jelly, pellet insertion, and then the implant. So most men start with ED, and now you've got these online platforms where they can just essentially download an app and essentially just ask somebody for Viagra and they'll get it. What's interesting about pills is, 50% of the prescriptions that were filled for Viagra and Cialis weren't refilled. So it's very interesting. So they're very, very sensitive to food. So, a lot of patients would come and say, oh, I tried a Viagra and nothing happened. I was like, you try it on an empty stomach? And they're like, no, nobody ever told me. And I try to tell patients, I was like, look, you got to work with the confines of what we're looking at, right? So this has got to pass through your liver and your stomach. So it's going to take time to get there, right? So we need to think about that, right? And then we also have to think about the side effects: headache, blue vision, low back pain, right? These are all side effects of the pills, right? Not to mention the lag time. You got to think about what you're eating or any alcohol you're going to intake and ingest. That can definitely affect it, right? So there are four major pills that are available, right? You got the sildenafil, tadalafil, vardenafil, and avanafil. Avanafil is more penile selective, where sildenafil and tadalafil are older drugs and they're a little bit dirtier, and that they hit multiple receptors. Like sildenafil can cause blue vision, right? Tadalafil will cause low back pain. I'm not a big fan of vardenafil because it will interact with a couple of the antiarrhythmetics, and you don't want to mess with somebody's antiarrhythmetics. So this slide's going to take 30 minutes before. It'll really depend, right? It'll depend on your digestive system, and it'll also depend on if you've eaten. So those are all things that are caveats. I tell all my patients, empty stomach, 1 hour before, right? And the blue vision, blurry vision, headache, flushing, those are real. The low back pain is something more to Cialis. The blue vision is more to Viagra. Stendra's a little bit weaker, and Levitra has a little bit more of a headache associated with it. When pills fail, the next best thing to offer you, or I don't know how much you think this is better, is just put a needle in your dick. Oh, that's so hard for me to sell to men. So I'm like, you went from pill to needle. It's very, very hard for me to get these guys to think about this unless they're injecting for testosterone, or they have, taking these new diabetic injections that are available. It's very hard to convince a man to take a 31 gauge needle into his dick and inject the medication and to have sex. So what's interesting about this is, this is medication that you're injecting inside the erectile bodies. And it's, we usually use bimix, trimix, and super trimix, and something called quad mix. There is penta, but I didn't think it really works very well. And the problem with this is, as you can see, you literally have to hold your penis. I wouldn't do what the picture is. I think it's wrong. You got to hold your penis out, and then you got to put a needle into it. And if you put it in the wrong spot, you're going to get a bruise. You could, urinate blood if you put it in the wrong spot, right? And then you could also, if you don't put it deep enough, just have a little welt under the skin, and then your partner's like, so what's supposed to happen? So usually the onset's about 15 minutes, I tell patients, and you may need to redose it. So what's interesting here is we send you home with the trimix or the bimix, and we're like, all right, have at it. The dosing schedulement's a regiment, right? So I'm like 10 units every 10 minutes until you get the effect that you want. But if you get an erection over 4 hours, you go into the OR, you go into the ER because you have to drain the blood out, right? So something to keep in mind there is injections, do have that slippery slope. We have a great gas, but a very weak break. Something of a long-term issue, and this is something I check on my patients about once or twice a year. I'll have them get penile ultrasounds to look for any calcification or fibrosis or Peyronie's disease. Injections has been and is a risk of Peyronie's disease, right? As is bending with penetration. Those are going to be risks. Vacuum erection devices. I think these are excellent pre-penile implant treatment options for men. I think that VEDs with rings are kind of dangerous. I've operated on several men who have injured their erectile bodies from leaving the ring on for too long. So I had a guy come in and he used the vacuum, put the ring on, had sex with his wife for 2 hours, couldn't get the ring off. It took the next day, went to the ER, got the ring finally off. And, then he had a permanent, indentation, a wasting at the base of his penis. And we had Peyronie's disease, and we just couldn't get good blood flow past that area. I mean, I don't think you're supposed to have a cock ring on for 12 hours. I usually tell patients 30 minutes is kind of like the limit of what you're looking at. But we'll come back to the vacuums, and we'll talk a bit more about it with the implant. The nice thing about the vacuums is you can get them over the counter. There's no side effects drug-wise. You do have to use a ring to keep the blood flow there. There is a ring that I like better because it lets you ejaculate. It's called Get Me Giddy. It just pinches kind of like this. Instead of like circular compression, it'll leave the urethra open. If you inhibit ejaculation, you can have blood. So I'm not the biggest fan of rings. Risks is the erection's cold. How long do you want to leave your favorite limb with no blood flow? Numbness, tingling, and bruising. Painful ejaculations because you're using one of those cock rings that are going to be circumferential compression of the urethra. So Muse, right? This is I like the jelly format of it because it's kind of hard for you to put a pellet in the urethra. And this is a pharmacological vasodilator that comes in pellet format and also in jelly format. Now, I will tell you, I'm having trouble getting the pellet format of this. Pharmacies just aren't stocking it. And this, you put a pellet in the urethra, and you have to massage the penis. You got to massage that pellet down the urethra, and it'll dissolve over the corpus spongiosum and then the corpus cavernosum, and you'll get an erection for about 30 minutes. I have had several patients injure their partner's, genital area with the fluid coming out too soon because they didn't wait for it to fully absorb. This doesn't allow for a shot, but it's still a problem. So the penile implant is a self-contained surgical device that we place inside the penis that has a hidden reservoir, 2 cylinders in the shaft, and a pump in the scrotum. This works with a 96 to 97% satisfaction rate, right? So this is a long-term solution, right? These devices last about 10 years. The implants themselves have high satisfaction rates. They're concealable because they're inflatable. We'll talk about the malleable one, I think, later. This will mimic a natural erection. It'll give you an 1,000 psi, which is over the 900 psi you had when you were 18, and it gives you an erection instantly and spontaneously. It allows you to control the erection by pumping up this pump inside the scrotum, and there's no other equipment for you to worry about. Everything's self-contained inside your body. So here we're going to have a short video on how to inflate and deflate the device. So usually we'll make a cut above the penis or in the scrotum. So we'll make a cut up here above the penis called infrapubic, or in the scrotum called penis scrotal. And we'll load the cylinders in, load the pump in, and place the reservoir next to the bladder. Unless you've had an injury or surgery down that area or radiation, we'll tunnel it underneath the muscle and the reservoir will go upwards. Most of the time you can't feel the reservoir at all. When you want intercourse, you grab that third testicle, your pump inside your scrotum, and you essentially squeeze it. And it's a slow squeeze. Unlike in the video, it's a 1 to 2 second squeeze with a release, squeeze with a release. You want to spend, of course, a solid second squeezing the pump and wait for 2 or 3 seconds for it to recoil. You want to definitely let it recoil. When you're done, hit the deflate button and squeeze the shaft. There's two types of deflate options. One of them is the older Titan Classic, and the newer one's a Titan Touch. The Titan Touch is a one-handed operation, and the Titan Classic is a two-handed operation. The valve only works when you press it, so you can't deflate it unless both your hands are on the system. So the satisfaction rates, like I said, is in the high 90th percentile. It's just not talked about much by men. Partner to satisfaction rates range between 70 to 90%. They're slightly lower. I blame the men for that. This slide is interesting because it talks more about why you'd want a Coloplast Titan implant. It's got a material called Bioflex, and Bioflex allows the surgeon to pick what antibiotic or antifungal or whatever agent that you're going to have to kill bacteria and funguses to be eluted by the device. It lets me pick. And I use something called Ericept, and they did not pay me for it. I did not work for them for it, but it works by killing viruses and funguses and bacteria. So I want to be able to cover what I have, and not worry about, did I cover viruses? Did I cover fungus? I don't want to think about that, right? So the other company out there, the AMS, is pre-coated, right? The device itself is thinner. So the Titan's 22 to 23 millimeters in diameter, where the AMS device is about 18 millimeters in diameter. So you can already think of tree trunk and twig, which one's going to be harder, the Titan. This is especially important for patients with Peyronie's disease. I usually will steer patients with Peyronie's disease towards a penile implant that's Coloplast based because of that reason. Right? We talked about the more girth and the more rigidity, right? So A, more rigidity, B, more girth. Those are good, and C, more durability, right? So you have better penetration and better power. So I did a nice study in 2016. We looked at axial loading. We found that the axial loading for the Coloplast Titan implant was higher, which was a lot better because it could handle more stress. The malleable implant. It's a good device for patients with pill rolling tremors or issues with dexterity of hands. They're hard all the time. It's concealed inside the body, so the two erectile bodies, right? And we put 2 cylinders in, and you bend it up and you bend it down. The problem is you're hard all the time. The problem is you're hard all the time, right? So it's a good and a bad problem to have, right? So, you may want to try to conceal your penis from being hard all the time. With any surgery, there are risks: bleeding, infection, scar, right? Device malfunctions around 1 to 2%. Infection in most high volume implanters' hands is going to be under 1%. Mine's 0.4. Inflation and deflation difficulty, I would say, happens about 5% of the time. Erosion's a very rare one, another 2%. Incorrect sizing, if you go with a high volume surgeon, that shouldn't be an issue. Penile implants covered by Medicare. They're covered by most insurance plans. I know I can call out Aetna right now for saying they usually don't cover it. They're difficult to deal with, but Medicare does pay for it. I'm not sure about the other ones. It just depends on your plan. We can appeal if you get denied. We will work with you on an out-of-pocket price, try to make sure we can definitely help you get that implant placed if that's something you desire. If you look at the cost effectiveness, Viagra, if you're buying about 30 tabs, can range between $7. This site says as high as 360, but I've seen it usually averaging in like the $70, $60 range for a couple of months supply. So you're going to be racking up the money annually, and it'll end up saving you money. So the annual cost of injections is about $8K, and the implant average cost after 10 years is going to be about $4,000. So it's cheaper, but the spontaneity is much there. We're going to get a patient's perspective now. We'll just have them come on and chat about their experience with the penile implant.
There was a period where we had both made a decision that okay, this is not working.
We was gonna have a sexless
We were okay
marriage.
with having a sexless life. It was gonna be okay.
My name is Tony. I'm a veteran, and I'm 63 years old.
I'm CC. I'm 61 years old. I'm in the health and wellness business, and we've been together 7 years and married for 5 years.
CC and I were married October of 2018, actually. The following month, I was diagnosed with prostate cancer. It wasn't quite a stage yet. It was just the beginning of it.
When he called me, the first thing was prayer. And I told him, I said, I got you. We got this. So
my doctor went over the different procedures to go with, and he laid out all three of them, actually. And I never forget, I said, which one do you think? He said, I cannot make that decision for you. So I have to leave that one up to you guys. And we turned to each other after he had broken them all down. I looked at CC and she said, we're going to remove. I said, exactly. And that's how we came up with the removal. The doctor broke down the possibility of having erectile dysfunction. And we looked at each other, and CC actually said it, we're not going to worry about that.
Mm-hmm.
We want to get this cancer out of here, and we'll cross that when we get to it. Had the surgery, everything he said we was going to go through, I went through it. I had to go back to see him 6 weeks later. Cancer, my PSA came up 0. After prostate surgery, we wanted to figure out where I was with erectile dysfunction. So my doctor at the time, he put me on Viagra. I took it every day like a vitamin. That did not work. Then we went up to Cialis. Same situation. And he said, well, let's try it with a pump. So I went out and bought this expensive pump at a store that I normally don't go in. We tried that. Some success, but just some, not enough to say it fixed all. Then the next thing he recommended was the penile shot. I hate shots. I still hate them to this day. And where I had to use the shot at, that didn't help at all. So that didn't last long.
Yeah, it was a hot minute. Through all of it, the Viagra, the Cialis, the penile pump, there were times we were just like over it. For instance, the Viagra, if we went on a trip, we had to make sure we had the pills. The shots were the worst, though, because you had to keep them on an ice pack
at a certain temperature.
So traveling with the shots, we had to make sure we had an ice pack. We had to make sure we had the needles, and then the little thing. And then I had to give the shots because Tony wouldn't. Tony wouldn't give the shots.
I couldn't stand to look at the shot.
I had to freaking give the shots.
And she nervous.
She nervous. And then I was like, I just can't do this anymore.
Yeah.
You know, it really did. It got to a point where I just couldn't do it. And
then the shot was a hit or miss. It was more miss than hit. That was the other thing.
I had a friend that at a young age that had an implant. So I went to Tony one night, and this was a night we had tried something and it just wasn't working. And I said, had you considered a penile implant? And so we talked about it, and it went from there.
And I said, we've tried everything else. Yeah. This is the last train out of Clarksville, so let's go for it. Before receiving the implant, my concerns were how natural it was going to feel. But now that I've had it almost 2 years, I give it a 98% natural. And
one of the questions that we get is, how does it feel? A lot of women are sort of embarrassed to ask that question. It is natural. It has a natural feeling. That's huge. To know that and to be comfortable. You have to get out of your head, get out of your own head, because your mindset is going to tell you that, you know, you have this thing there, but it's not. Once you get past that part of it, it's natural. Now that the penile implant is there, we're good. It's the best decision we've made. Yeah. It brought my confidence back. It opened up a new energy that I didn't think that I could have at this age. I'm not gonna say I'm gonna run the Boston Marathon, but you got that pep in your step. Yeah. It brought that back. Brought that pep back. For the partner, I would really advise to just have the conversation. We can sit up and talk about pretty much everything, but when it comes to our sexual life or our intimacy, we don't. Just have the conversation, talk about it, make a decision together. Don't be ashamed about what's going on and how you're feeling, and ask him the question. Ask the question, what can we do next? And would you want to? Because you never know what the answer is going to be. We have a good time. We don't have to plan anything. So that's the part that we're enjoying now, embracing it. For a relationship that started 7 years ago, and it started out with health problems that we didn't even know that I had, that we discovered after we got involved. I appreciate that you did not leave me. And that meant so much to me. Even the fact that we didn't even have a sex life for about the first 2 years, that meant a lot. So I knew when we did discover the doctors, urologists who turned us on to Coloplast, and you were still there, so I know we're gonna ride this till the wheels come off. Till the wheels fall off. And we're gonna live happily ever after.
Okay, frequently asked questions. How much does the implant procedure cost? Usually cash, it's around $22K. Usually how much it costs total. Is it covered by insurance? The answer is yes. It just depends on your insurance, and it'll just depend on your surgical deductible. Will it affect my penis size? The short answer is maybe. And the reason is because if you don't stretch your penis before surgery, you'll get shorter, going back to the vacuum. So you want to vacuum your penis before surgery, right? You want to stretch your penis out in the vacuum chamber for 10 minutes every day before you get your implant put in. Orgasms and ejaculation are not affected by the implant. They were the way they were before and after surgery. Will a penile implant affect sensation of my penis? No, it won't. Will anyone notice I have the implant if you leave it inflated? Right? Will my partner notice a difference during intercourse? Most patients tell me that their partners tell me too, that 70 to 80% of the time they can't really tell. And after about 3 to 6 months, most patients forget it's even there. They're just like, it's part of me, and they just move on. And most intercourse is natural. It just depends on kind of glans fullness. And that's going to be something where the head of the penis is not full, then you're going to feel the tips of the cylinders, during penetration. Recovery is a tricky one. It says, what's a recovery period like? I usually tell patients you're going to be sore for 1 to 2 weeks. You start cycling up about 5 to 7 days after surgery. I numb patients up with something called liposomal bupivacaine. So you're numb for 2 or 3 days. And I let the patients use the device usually at 4 weeks if they go infrapubic or above the penis, and 6 to 8 weeks if they go below the penis, which is more hidden scar, but the scrotum takes longer to heal. Can I continue my normal workout routine and everyday activities? No. You need to give yourself a solid 3 to 4 weeks before you do any working out, because you're going to rip stitches, right? Will I be able to have spontaneous erections with a penile implant? The short answer is yes, because you can still get erections around the device. If you were able to get erections, then you could still get them. Does the penile implants interfere with other equipment? There are MRI conditional. Some airport machines, the clear wiping machine will pick you up if you go through it. If you have any more questions, I think you should definitely check out the Coloplast website, coloplastmenshealth.com. You can check out La Bombita in Spanish. You can check out my website at atlantacosmeticurology.com. But go seek a urologist, go seek a high volume specialist, and find somebody that does a lot of these surgeries, because you only got one penis and it's got to go right the first time. Thank you for attending. You can use your phone on your camera, scan this, and learn more about penile prosthesis.